Hi everyone, happy Easter. It's still Easter, and here in Belfast it's actually snowing, for goodness sake. What can I say? We've got snow at Easter. But what to do if someone is having a heart attack? Would you know what to do if someone was having a heart attack, or would you panic? Don't worry if you panic. I would say that the most percentage of people would panic. I wouldn't panic because I would know what to do because I've had a heart attack. I always now carry an aspirin. The aspirin I take sort of for my heart problems is 75 ml, but the one I sort of carry about with me is 325 ml. And I always make sure that people that know me know I'm carrying that aspirin. There's no point if I'm in pain, I can't sort of put my hand in my pocket, having the aspirin in my pocket if I can't use it. So I always make sure that people in work, people at home and so on, or when I'm out, people sort of know me, know what to do. But I read in a forum that this lady was out cycling with her husband, and the husband collapsed off his bike, and a passerby had the presence of mind to know what to do. He slipped two aspirin under his tongue and made him suck the aspirin, which then sort of dissolved a bit of the clot, and that kept him sort of all right until the ambulance arrived. Whenever he got to the hospital, the doctor actually turned around and said giving him the aspirin was really helpful, and could possibly have saved his life, but he might have survived till he got to the hospital anyway, just the way I did. But what I do is I always carry the 325 tablet of aspirin, and always make sure it's a wee round white one. Don't because it dissolves right away and acts right away. You can get the sort of capsule one that's sort of like two colours, and it's a plastic coat. The coating has to sort of wear out before the actual aspirin starts working. So always get the white one, the round one, because it dissolves right away and acts right away. But the main thing is what to do if someone is having a heart attack. If you're in work or sort of in a supermarket or somewhere like that, and you see someone sort of go down, the first thing to do is make them comfortable. Before you even check their symptoms, you sort of look at them and sort of know if something's, whether it's just sort of a panic attack or something like that. But if you sort of think that it is a heart attack, check their symptoms, see if they're sweating profoundly. Do they have a chest pain? Do they have pains in their arms? Get all the symptoms, then shout out to someone. Phone an ambulance, please. Tell them make sure if they're conscious or unconscious. Get an ambulance, please. And we've got a conscious patient here who's having chest pains, and they've got pains going up their arm. That means whenever the ambulance is on the way, and it'll be on the way right away when they know it's a heart attack, and they will be able to sort of prepare whenever they get there, because they'll know that the person's sort of nauseous, they have sort of chest pain. Another thing, if you even ask the person how long they've been having the chest pain for, and pass that information on to the ambulance as well. Because if you're actually on to someone on the emergency number, they'll probably stay on the phone to you until the ambulance arrives, so that they can keep passing information on to the ambulance people, so that they have every single bit of information for when they arrive at the scene. What you should do at the scene, or what I would do, is the video is about what would you do if someone was having a heart attack. Now, basically what I would do is make the person comfortable. If they've got something tied on, loosen the clothing a bit so they can breathe better. Get that 325ml tablet of aspirin, slip it under their tongue, get them to suck that tablet, because that 325ml tablet of aspirin will actually slightly put a hole in the clot. It will let the blood flow through, and hopefully, now I'm not saying every time, but that should get them to the hospital where they will be able to break the clot. But in the meantime, when you're with them there, the CPR is for somebody that's unconscious. If someone's unconscious, you do the CPR, but the CPR does not have a great sort of percentage rate of success. The machine is much better, the defibrillator. I know there's a place in my estate where I live, they have a defibrillator on the wall. The defibrillator is just like a TENS machine. You put like a sort of TENS thing there, and then you put a pad there, and a pad, I think there's 4 pads, I'm not quite sure, and then you actually press a button and the defibrillator talks to you. It actually tells you all what to do, and it actually does an ECG of the patient on the ground, right? If they're unconscious, it will do an ECG as they're lying unconscious. Now, the thing about the defibrillator is, if they're not having a heart attack, the defibrillator, it knows they're not having a heart attack, so it will not shock the person into, coming back. But if they are having a heart attack, the ECG will pick that up and the defibrillator will shock them, right? And hopefully that will keep them going until the ambulance arrives. That's a worst case scenario. Hopefully they're not unconscious. Hopefully they are conscious and you've got them nice and relaxed, and you've told them that an ambulance is on its way and that they're going to be all right. Once a person hears the words, sort of an ambulance is on the way, you're going to be all right, it sort of relaxes them a bit, and that's the way you want them relaxed. Have them relaxed, thinking, I'm going to be all right. You're going to be all right, and do 325 ml aspirin it is, slip it onto the tongue, get them to suck it slowly. And it has been proven on numerous occasions that this 325 ml tablet, the aspirin, will actually put a small hole in the clot and allow blood to flow. And I mean, it's not going to cure the heart attack, but it will help the person breathe and sort of be there whenever the ambulance arrives, and then they will be able to sort of give them the proper treatment, and then they will get the clot bust, get stented, and hopefully survive. And one day, if you actually follow that advice, you may save someone's life. So what to do if someone has a heart attack? I've just told you what to do, and that could save someone's life. You could save someone's life. So carry around a 325 ml of aspirin. You never know. That person might be you. You might actually be conscious. You might be having a heart attack, and you might just put your hand in your jeans and put the tablet under your tongue and even save your own life. That's just my advice, by the way. I'm not a qualified doctor, but I do know that works. Google it. Prove me wrong. But it does work. Have a good day, folks. And now you know what to do if someone's having a heart attack. You take care. Alright, thank you very much for watching. Oh, before I go, if you're a YouTube subscriber, if you're YouTube account holder, please subscribe to my channel and hit the wee bell there so you can get notifications of further videos, because I intend to bring you lots more and try and help you and things like that. But it'd be nice as well if you leave a comment. I appreciate the comments, but I haven't really had any because it's only a new channel which I intend building, and I'd like to build it with people like you that are watching right now. So if you could leave a comment, it's nice to share an experience. Have you actually seen someone having a heart attack sort of in a shopping centre or something? Did someone do that? Did someone apply CPR? Did someone go to a nearby defibrillator, take it out and use it in the person? Did the person get to the hospital? Did the person survive? These are all comments that we could be leaving down below, and we could all be sort of interacting with each other. That's the point of having the internet, to interact with each other, to help each other, to do videos like this, so that whenever sort of, what to do when someone has a heart attack. I've just told you what to do if someone has a heart attack. Now you know what to do. And, these are all things you can find out on the internet. And I'm now trying to supply this sort of information. And it would be nice to read comments on, the experiences of other people. I don't just want to be here just to give my advice. I want to read what other people have done and, share other people's experiences and help each other out. I wish someone had helped me out the day I had my heart attack. But I had the presence of mind of sort of what to do because I'd been a first aider. But I don't sort of regard myself as smart or anything like that. I was just lucky in the day. That's one thing in life. Life is all laid out for you. The good Lord is up there and He's watching over you, and when He wants to have you, He'll have you. But in the meantime, let's do the best we can for each other. Have a good day, folks. Take care.